Hola. Hello. I'm sorry, my Spanish is not good enough to speak in Spanish, but I will hopefully be able to give you some perspective. I'm Zhang Nunes. I'm come from California. I'm the director of oculofacial plastic surgery at USC in Los Angeles. And one of my passions is about education. I was fortunate enough just recently to receive the Women in Ophthalmology Award for Education. And so it's my passion to talk to you about what we can do to advance our field using education. Okay. So how do we push our field? I'm sorry, my mask is still on, I realized. How do we push forward our field of oculofacial plastic surgery? Education is a big part of it, and this section has been amazing. We have had wonderful talks about education and marketing and how to portray our specialty and what we do. But I think it starts with educating ourselves first, educating the trainees, our fellow surgeons, on the full spectrum of oculofacial plastic surgery. So I wanted to go over a little bit of what we do in the United States, the ASOPers Fellowship, the rigorous training requirements we have. There's a course that I run called the Oculofacial Surgical Skills Course, the Cutting Edge, and where I invite all the ASOPers fellows from around the country and other practicing surgeons. And all Open Up members will be invited to join us as well. And there's other courses such as at the American Academy of Ophthalmology, and then I will also discuss how we educate in aesthetics, such as using Botox filler courses. So once we've educated ourselves, the idea is that then we can bring awareness to the public about what we do, the extent of our training and our full capabilities. And that we can use the expertise of many of you here who are very adept at social media, your beautiful websites, how to portray ourselves in the media as well. So, starting with training our fellow surgeons and trainees. So this is a busy slide, but I wanted to spend a little bit of time telling you about how we run our ASOPers fellowships. It's ASOPers, the American Society of Ophthalmic Plastic Reconstructive Surgery, accredits about 56 fellowships now. They are all 2-year fellowships. Half of them are even year and half of them are odd year. And the idea is to teach the full spectrum of reconstructive and aesthetic oculofacial plastic surgery. And this is under the direction of an approved program director who's approved by the society, and there are a limited number of fellowships, and all regulated by ASOPers. In terms of surgical requirements of the fellowships, we do have a minimum total of 750 total cases with 300 as primary surgeons. However, most ASOPers fellows have 2 to 4 times that requirement. They're very heavily surgical training. So for example, the 2019 to 2021 cohort had an average of over 2,000 cases in their 2 years total, with the vast majority of those cases being primary surgeon. And we define primary surgeon role as greater than 50% of the case, and one side can be one case. So there are 2 fellowships that ASOPers recognizes, the 2-year fellowships that I mentioned for those having completed an ACGME or our Royal College of Physicians approved ophthalmology residency. And there are some international fellowships as well. Many of you have probably already participated in those, and those are attended, they are 1 or 2-year fellowships, and they're intended for the international community who will return to their home country. There is more information on the asopers.org fellowship website. And so the other requirements, as of April 2021, are extensive. We've gotten more rigorous over time. You know, ASOPers is now over 50 years old, and over time, our fellowships have become more and more rigorous to push our field and expand our scope. So we have strict requirements for program directors and the core faculty who will each have dedicated time to teach fellows and allow fellows to operate as primary surgeons when they're ready. Each program needs to have an academic affiliation so that there can be research that can be done, and each member of ASOPers needs to write a research thesis. There's 10 hours of pathology slide review with clinical correlation, and the fellows have to participate in a minimum of 80 hours of didactic instruction, which can include seminars, grand rounds, lectures, and hands-on skilled courses. So for example, we have to have minimum quarterly journal clubs, fellows conferences, fellows have to present cases, attend at least 6 hours of lectures, and give lectures to the ophthalmology residents or another community as well. And there's attendance in at least 2 courses devoted to oculofacial plastic surgery, and including another one for facial and orbital dissection. So that leads me to share about the course that I developed starting about 6 years ago at USC. And we invite fellows from all over the country, and this is the one I mentioned where you guys are all invited as well. Is there the music? Maybe is playing. So it's a wonderful 2 full-day course, hands-on, people, mentors from all across the country and international mentors as well. Maybe one of you guys can be one of the faculty one year. Practicing surgeons come around. This is the whole Bascom community that also came. And we really cover the full spectrum of oculofacial plastic surgery, including aesthetics and functional. A lot of anatomy. These are all, there's 15 cadaver heads that we're learning on, and you get to every procedure stage. There's guidance during the course for 10 minutes, a demo, and then we have hands-on right then, right there. So everything is a lot of doing, a lot of experiencing firsthand what it is to practice these surgeries. And I have to say, it's one of the most fun things I do. And what I love about it, it's a lot of cross-pollination. We teach each other. This is how we make ourselves better. Just like this conference, you guys are teaching each other. So teaching each other is what's going to push our field forward, and we are going to bring the best minds together and push onward into the next century. So this is the agenda. For example, this is, again, it's 2 full days, full day Friday, full day Saturday. We cover things including newer procedures like corneal neurotization. We also cover rhinoplasty, full facelifting. As you know, in our requirements for your ASOPers fellowship, you are required to do a certain number of rhinoplasty and facelifting as well. So we are truly oculofacial surgeons, and that's what we want to train our trainees to do, as well as make the public aware those are our full capabilities. And if any of you guys are interested, feel free to register on the website here. And this faculty list may be changing as well. So what are other courses? There are plenty of courses at AAO. For example, this is the Advanced Flaps course that I helped to teach. There are also courses that are taught around the country. There's one in St. Louis where what I like about those is those bring people from all the different fields. So you have ENT facial plastic surgeons teaching, you have general plastic surgeons teaching, and oculoplastic surgeons. And these courses combined can really cross-pollinate across the subspecialties as well. So another one of our courses that we want to teach, where we interface with other subspecialties, is the aesthetics in terms of the non-surgical training, so neurotoxin and filler courses, and that's something we also host as well. So that for my neurotoxin filler courses start with lectures for indications of neuromodulator treatment, indications of soft tissue filler treatment. We talk about the different methods, cannula versus needle, safety, the different types of fillers, impermanent fillers such as HA, calcium hydroxyapatite, PLLA, and the dangers of the permanent fillers, as well as fat transfer. And then I put a big focus on complications, because that's what every surgeon and every physician needs to know. If you're going to do a procedure, you need to know how to manage the complications. Right, so we talk about ischemic complications such as blindness and necrosis, non-ischemic, such as nodules or overfill, the blue hue effect, the Tyndall effect, which is the old name for that. And then I did some research on how to titrate hyaluronidase, which I'll talk about in my talk tomorrow, based upon which HA filler and how much you want to dissolve. And then there's many hours of hands-on demo and direct practice on live patients. So this is For example, one of the courses I teach at USC, I've taught courses at various other places and to other physicians as well. So we first demonstrate and then have them do hands-on. Again, there's the emphasis on the complications with that photo of the ischemia to the nose and the eye in that one patient from South America. And then this is another course I alluded to, which is teaching other physicians, maybe not within our specialties. So we teach ophthalmology and oculoplastics, but we can also teach the other physicians, such as what we call the core physicians, such as plastic surgeons, ENTs, facial plastics, dermatologists, and then the non-core as well, people who are in family practice, OBGYN, emergency medicine, anesthesia, PM&R, they want to go into aesthetics as well. Should we be teaching them how to do this? And then same the question for allied health professionals, NPs, nurses. They do a lot of this, and sometimes they're the ones who do most of it. So I do feel that it is important to teach them as well, because they're probably going to do it anyway, and they might as well learn the safest ways to do it. And we as oculoplastic surgeons have a special, unique perspective in how it can affect the eye and around the eye. So I always emphasize to know their anatomy and know how to treat complications. I would love to hear how you guys manage this in your own countries, the kind of the turf battles and how to teach our collaborators and other people in our field. Then these are just some examples of slides I've used to teach how to do lower eyelid fillers, the cannula technique. I again emphasize the anatomy. So this is just, in the interest of time, I'm going to move on so I don't show the detail, but I clearly talk about the infraorbital fissure, or nerve, a vascular bundle, how to avoid that with a cannula, how to not overfill, all those things. I'm trying to advance. There we go. And then there's always people who ask about how to do superior sulcus filling. I think there was somebody else who demonstrated something like this earlier. And I also use a cannula in this area, although there's various techniques you can use. Okay, so these are some before and afters. This was an interesting case. Thought about what do you notice about her left eye. That's the one we filled. And she came in asking for a blepharoplasty on the right side. This is right after filling. This is right after the procedure. And then 2 weeks later, her right brow's lower. So if you'll notice that looks to me more youthful. And I think she originally wanted something on the right, which to me looks like a more aged, right, experience. So that's where it is useful to kind of teach our field and how to do this safely, and some other before and afters. So these are just examples of teaching slides I've used to teach how to do fillers and Botox to the other folks. And in the other person's case, blepharoplasty would have been recommended, but as a temporizing measure, we used fillers instead, and cheek fillers. Okay, so my questions for discussion, if you guys, if we have any time today, is how do you guys train fellow open-up surgeons? Do you want to, can you even regulate the quality of the training? It's very challenging because everybody's from different countries here. But whether we can regulate it or not, how do we continue to work toward elevating the quality of all oculoplastics training? Then who and how should we train in aesthetics? That was one of the other questions. And finally, I want you guys to tell me, you guys are the experts at this, how do we bring more awareness to the public about what an oculofacial plastic surgeon can do? Okay, and so thank you very much. This is my contact information. These are some of my residents and fellows who've trained with me, and it was a pleasure and honor to speak with you all.